Hi everyone, I am Aninda Nishat Moitry. I am a second-year DPhil student based in Ito, and I will be talking about the core question of my DPhil, which is which antimalarials can be used safely in pregnancy. So the motivation for my research is the fact that malaria in pregnancy poses significant health risk to both the mother and the child. Therefore, pregnant women need safe and effective antimalarial treatment to avert these serious complications. However, concerns on the embryotoxicity and teratogenicity, which means birth defects basically, limit the use of effective antimalarials in pregnancy, particularly in the first trimester. As an example, recent studies have shown that artemisinin-based combination therapies can be safely used in early pregnancy. Yet, except for one drug, most ACTs are not recommended to be used in the first trimester due to the limited evidence on the human safety. So it is imperative to collect more data on the safety of this ACT to strengthen the evidence base. Having said that, establishing drug safety in pregnancy is not easy because randomized trials are rarely conducted involving the pregnant woman, and the available studies are observational in nature with limited scope for quantifying the causal effect of antimalarials on the adverse pregnancy outcomes. So that brings me to the overarching aim of my DPhil, which is to estimate the causal effect of the commonly used antimalarials on the adverse pregnancy outcomes from observational data. And my first objective is to determine the association between antimalarial exposure in pregnancy and adverse pregnancy outcomes based on the best available evidence. And I am conducting a living systematic review for that. My second objective is to identify and evaluate different strategies to establish causal relationship between antimalarial exposure in utero and adverse pregnancy outcomes like miscarriage, stillbirth, and major congenital anomalies within observational studies. And finally, to develop best practices to analyze pregnancy exposure registry data, which will serve as a methodological example for the future studies. So for the second and third objective, I am analyzing data from Mimba pregnancy exposure registry, which stands for malaria in mothers and babies. So this is a multi-center, multi-country observational prospective pregnancy cohort. This is set up in 2 malaria endemic countries in Africa, and till date, the registry has enrolled more than 60,000 pregnant women, women of childbearing age, and detected 12,000 pregnancies. So having addressed this research question, I believe my research will contribute in generating robust evidence on the safety of antimalarials in pregnancy and will inform the policymakers, regulators, and clinical practice. Thank you.